Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 18th of August 2021. The numbers to begin with, today we've got 24 COVID positive patients in hospital. That's within 14 days of their first positive swab. There are 2 in critical care, 22 in our general beds and none at Clifton. That compares with 25 last week, so it's a pretty stable number. And as I explained last week, across that number, this will include patients who are in our maternity unit, who are in for surgery. So not everybody in that 24 is in hospital because they're poorly with COVID, but some people are very poorly with COVID. 2 in critical care, and I'm sorry to say we've had 3 deaths in the last week to report, and that takes our total up to 784. So that's people who passed away in hospital within 28 days of their first diagnosis of COVID. And as ever, condolences to the relatives and families and friends of those bereaved. We've also got 11 patients in hospital who are in because of COVID but are more than 14 days, so not considered to be infectious but in because of COVID. And it gives a kind of picture of us sort of plateauing out and not being entirely certain which way the numbers are going, so we have to remain very vigilant in that regard. And to illustrate that more, if we look at the community numbers, the numbers I've got today are Blackpool 400 cases per 100,000. That compares with 491 last week, so a bit of a reduction. For Fylde, 270 versus 320 the week before, and for Wyre, 322 versus 280 the week before, so a little bit of an increase. So we're seeing a kind of, plateauing, I think, at the moment, although maybe the trend is in a downward direction. And that's probably to be expected as there's such a lot of increased interaction, increased activity across society generally. It's pleasing to note that the number of second vaccinations is creeping up, and we really need to keep going with that. So it's 71% for all adults in Blackpool, 80% for Fylde and 80% for Wyre. So if anybody's waiting to have the second vaccination, I really encourage you to get on and get that done. And of course, if you're an adult who's still not had any vaccinations, then my view is, the general view is that the evidence is compelling that the vaccinations are effective. There's been a particular issue around maternity services. So for pregnant ladies, we've seen some really poorly pregnant ladies. Not everybody, of course, but the evidence is clear that the vaccination is safe both for mum and for baby. So a very strong recommendation for pregnant ladies to be vaccinated, please. I think the other point to make about vaccination is I've heard younger adults, in fact I've heard my children debate this, about whether this is just about personal risk, so whether anybody needs to be vaccinated or should be vaccinated because of their own personal risk. Well, clearly personal risk is a part of it, but the whole point about a vaccination program is to get a kind of herd immunity, to reduce risk and transmission across the whole of society. And the more people who are vaccinated, the safer everyone becomes collectively. So there is a kind of collective responsibility when it comes to vaccination. We're not sure yet whether there will be a COVID booster, and that's subject to a lot of investigation, discussion, debate at the moment. But as I mentioned last week, if you are eligible for a flu jab, we will start the flu program as soon as possible, so in September at the earliest. It's going to be really important to get as many people immunised for flu as we can. And if the COVID booster program comes in, that will come with the flu jab program. So if you can get yourself booked for a flu jab, if there is a COVID program for boosters, it will fit in with it. So it's good to get ahead of the curve if you can do. Hospital visiting, we are going to keep our restrictions in place for now, but review this regularly. We'll certainly review it again on Friday morning. So general visiting is restricted. There are exceptions for maternity, for children, and for families and relatives of patients who are nearing the end of life. So those details are on the website if you want to get precision, but you can always get in touch with the ward and speak to the ward clerk or manager to get a clear indication of particular visiting if you've got a concern. And then lastly, because of all the loosening of social regulations, if you like, it's clear that there's much more mixing. Rather inevitably, not everybody's wearing masks in public spaces and so forth. Of course, we insist on that for anybody coming into hospital. So I suppose increasingly it's becoming a personal choice, but I suppose my plea is to everyone to be thoughtful about this, to consider social distancing still, to wear a mask if you feel anxious about it, and the basics of hand washing, regular hand washing, still so important. So thank you so much for sticking with it. We'll see how the patterns start to develop, and I'll update you accordingly. Thanks.